the charge of the cell and put inside the body with this dose the same information, and then the brain start to learn that this is the new state, and he automatically, after some sessions, maybe 6-8 sessions, automatically start to auto-regulate better than before.
And the power in this is that, once we are actually, there's inflammation in the system and the body is being triggered and the body is starting to lose that charge. And as you guys could see right there, my total energy is lower than the minimum optimal, which means that this stress and this inflammation has been going on in my system, and I've been dealing with gastrointestinal issues for a while now. So I kind of was expecting to see something like that. But then once we have the issue that's persisting in the system, the charge of the system is getting depleted. So now a lot of these therapies that energy practitioners and that's in the field, in the market that people are introducing, is to kind of like get rid of the symptoms and bring in the person back to balance. But once the person comes back to the balance, the charge is still low, we can maintain that low charge, but now to actually add more charge and recharge the system is where we're talking about Regmatex.
Exactly.
To be able to actually charge the system that's been through stress, through inflammation, has been losing this, the charge of wellness. And this is the way that we are pretty much, recharging the battery of the system.
Exactly. And I can use the Regmatex obviously alone because it's a device that works alone. But this is a kind of biofeedback called electrodermal biofeedback that works bottom up. What is the limit? There are some limits. The first limit is the patient is deshydrated, because if there's no water and no electrolytes, it's difficult to reverse the action potential membrane. For this reason, Nima, before the session, took a supplement called MGK, that's a supplement made with a rapport between magnesium and potassium 5:1, 1:5 in this case, and then that's able to restore the action potential membrane, and then is a little Regmatex. And before the session, it's very good to drink and take electrolytes like Mg-kappa from Melkalin. The other limit of the methodology is when a person is so much stressed that there is an interference from the limbic system that doesn't leave the bottom-up session works at best. And then, for this reason, I usually combine, because of our device can talk one with each other, we can combine a respiratory biofeedback, that's the gold standard to reset the limbic overactivation, and the bottom-up Regmatex biofeedback, electrodermal biofeedback, combining two for the best result. Perfect. And then let's go also with the PPG once more. In this case, not the PPG like an assessment of autonomic nervous system, but because of the PPG stress flow, are two devices in one, because there is the possibility to assess the whole state and function of the autonomic nervous system, but integrate inside the same device, there is a complete biofeedback system with a lot of different types of breath shape to make the practitioner able to give to the patient a real suitable and custom-made session of biofeedback. In this case, we can close this window and we go to Regmatex. And he asked to us, do you want to start Regmatex with PPG or no? Because, like I told, we can just use the Regmatex, but in this case, we have the PPG, and then why do not destruct it? And then it's yes. Because of the RMSSD of Nima, it was low in the first assessment. He's suggesting to me, the red one is suggestion of the device, of the software, to stimulate the vagus nerve, that is the most important nerve of our physiology. But I'm usually like to start with a session of just 5 minutes in a specific regulation, and then to move with a stimulation more specific. That can be vagus nerve stimulation, or to enhance some specific brain wave, like beta, or no, in this case I would like to stimulate like theta or delta to reduce the stress level and to regulate the limbic system. There are some blue programs called limbic system, or limbic system and autonomic nervous system, or stress system. Okay, let's go then to a specific regulation to regulate all the body. It's the more systemic approach, and it's good to start always with a systemic approach. I have a confirmation, and I have to choose one type of breath, and for the beginning I like this natural pattern called 5-5, and then it's Stroger-Meyer because it's 6 breaths in 1 minute, and 6 breaths in 1 minute is the frequency 0.1, that is the frequency of the Meyer wave. Are you ready?
I'm ready.
Okay, just breath following this one for 5 minutes.
Okay.
What can we see here? During the session, I'm talking in a secret way with you. Apart the autonomic nervous system, we are looking for the potential membrane action of the cell. 52 in a specific way is not bad, it's good. And you can see it here. Each one of this is a spike. But obviously, the best, it will be 100%, and we have to stimulate it. For now, it's 53%. Here you can see the real-time assessment of all the action potential of the whole body, and there's a block here in the range of frequencies between 200 and 250. We don't know which organ right now, but it's important that in case of block, does it mean that cells are not restoring and are not moving and changing, and then they're gonna die, and then it's an apoptosis of some cells that can't recuperate. Here is the range from 0 to 500 kHz is the range of the intra and the extracellular signals, all the body. Is made real time. Do you know, for example, the electrocardiography is measuring the electrical activity of the heart. In this case, we are assessing the electrical activity of the whole body. Well, in the second line, there's only the extracellular signals. How is working the extracellular matrix? In this case, we can see the typical waves that are related to the perfect physiology. And there's a block here, you can see, from 0 to 5 kHz. Does it mean a zoom of this window here? The third one is a zoom of this part, the first part of the extracellular, and this, and a very little part of the total, and represent the typical frequency of the brain, and then the brain waves. And in this case, there's a peak in the gamma that is related with the overactivation of the stress, with the typical lifestyle of a manager at the level of Nima. The rest are data related to the autonomic nervous system, like the scatter, the heart rate variability, the flow, the balance between sympathetic and parasympathetic system. And you can see here that the autonomic nervous system action is working a perfect way. With Regmatex, if we want, we can also measure the temperature to see if there is a lot of vasoconstriction stress related because of the circulation is in the hand only of the sympathetic nervous system. The peripheral temperature is very low, is cold. And then you can assess with the Regmatex, putting this on the finger, and during the session the patient try to increase the hot the temperature
of the
body. It's very interesting.
Wow, that was amazing. I feel so much more in tune, relaxed.
Yes, why? Do you know why? Because you decrease totally the VLF, that are the waves related to the stress, to the overactivation of the limbic system with the respiratory biofeedback. And then he was able to stop the interference from the limbic system to the bottom-up work of the Regmatex. For this reason, he reached an average of potential membrane action 44%. Is very far to 100%, but I can you can trust me that 44 in an asystemic way is not so bad, because the majority of person are in catabolic state, and normally daily I assist numbers like 3%, 6%, or in the better hypothesis 12%. Okay, but our challenge is to let this data to 100%.
100%.
To do this, now I'm going always with Regmatex and with PPG with the vagus nerve simulation, like a specific session that I can choose in the Regmatex.
Sorry. Turn it off. There we go.
Okay. Vagus nerve, confirmation. And I want to change the breath shape, because there's a typical breath shape validated in literature to stimulate the vagal tone. It's similar to what did you do before, 5-5, but in this case there's a little pause of 2 seconds in the middle. And this is validated in the scientific literature to stimulate the vagal nerve, the vagal tone, and for this reason the name is vagal tone 5-5. Ready?
Ready.
You have to exactly follow . We are really manipulating the autonomic nervous system. We are resetting, we are biohacking the autonomic nervous system. And for this reason, you can see that there's a retroactive intervention on the brain waves. There's no more that only peak on gamma. Without manipulating the brain waves, just stimulating the vagal nerve, there's a retroaction on the brain, and then you can see that now the delta and theta related to relax are more represented before compared with before. And what's incredible, the level and the number of spikes are much more than before. He's reaching the 100%. I promise him. 30%, or
wow.
in the better hypothesis, in 12%. Okay, but our challenge is to let this data to 100%.
100%.
To do this, now I'm going always with Regmatex and with PPG with the vagus nerve simulation, like a specific vagus nerve confirmation, and I want to change the breath shape because there's a typical breath shape validated in literature to stimulate the vagal tone. It's similar to what did you do before, 5-5, but in this case there's a little pause of 2 seconds in the middle. And this is validated in the scientific literature to stimulate the vagal nerve, the vagal tone, and for this reason the name is vagal tone 5-5. Ready?
Ready.
You have to exactly follow the red ball. We are really manipulating the autonomic nervous system. We are resetting, we are biohacking the autonomic nervous system. And for this reason you can see that there's a retroactive intervention on the brain waves. There's no more that only peak on gamma. Without manipulating the brain waves, just stimulating the vagal nerve, there's a retroaction on the brain, and then you can see that now the delta and theta related to relax are more represented before compared with before. And what's incredible, the level and the number of spike are much more than before. He's reaching the 100%. I promise him. Okay, first of all, how do you feel? Did you feel race heart or no?
Yeah, I feel very relaxed. I feel energetic. I feel like my mind is just like fresh. Like I just woke up in the morning, like first thing in the morning, the feeling that you have of that like freshness.
Well, TSDNN from, I don't know how, from 26 went to 70. Much more than 50, that is the cutoff. The power of vagal nerve is not perfect now because we made just one session, but starting from 13 to 25 is a very great improvement. There is not a perfect symmetry, but not comparing with this scenario related to the overactivation of the right hemisphere of the brain. Look at the difference. Okay? And that's why you was once more able to decrease the VLF, that are these terrible waves related to the overactivation of the limbic system and the central adrenergic pathway in the limbic system in the brain. But I would like to make a reassessment of your natural state. In this case, the PMN is minus 70, very close to minus 75. and then he restored the axion potential membrane at rest, while he reached, with the vagus nerve stimulation, in this case, 100% of PMN action.
Nice.
Average. Okay? From how much it was? 44.
44,
From
yeah.
44 with a specific regulation to the specific vagus nerve stimulation, the neuromodulation, the vagal neuromodulation that we use, combining, for example, this kind of therapy with the auricular acupuncture, that is very powerful to improve the vagal tone. You reach the, without acupuncture in this case, 100%. Fantastic. Okay, we reassess the PPG at rest after the session, and then be relaxed 5 minutes, just looking at your screen. Okay, let me see.
So this one was no stimulation. It was just my own measurement, right?
Exactly. It was an assessment at rest, a reassessment at rest that we made after the session.
Whoa.
Wow. And then what we can see here. First of all, the energy of Nima increased so much and in the right direction to the normotonia. Why? Because now he finally disarmed the limbic system, and you can see here with the VLF that are very low and with a perfect way called Meyer wave at 0.1 that represent our point of homeostasis. And you can see here that the frequency is 0.1, perfect, because the Meyer wave is from 0.08 to 0.12, but the power is not like 500, but for the first time it's very good. He reached an heart coherence. Does it mean a coherence and the dialogue between the heart and the lungs, the respiration, 100%, then higher
It's
than,
a heart coherence, right?
Exactly, heart coherence, yes. The SDNN now is normal at rest because 557, and the power of the vagal nerve, the anti-inflammatory pathway, is 40 in this case.
Wow.
And then less pain, less inflammation. Let we see, for example, the other data here. The flow, the tachogram is perfect, alternating tachycardia and bradycardia in a sinusoidal aspect, very regular. But basically, you disarmed, and how can you see here? Your right hemisphere now is lower than the left hemisphere related to the right hand. That is the cognitive part, the less emotional negative state. That and then we finally reach our objective. That's it. Fantastic, and congratulations.
Thank you. I feel amazing. I mean, I was like, wow. And my overall power to went over 8. So that was good.
Yes, you can also compare here, because here the first assessment and the second one. In the second one, your SDNN, that the index of general health, moved from 26 to 57. The MCD, the assessment of the anti-inflammatory pathway of vagal nerve, from 13 to 40. The total power, the energy, the cutoff is 8. You move from 6.5 to 8. The relationship between LF and VLF from 1 to 1.32, and then more LF, the good stuff.
That's the parasympathetic, right? Or the rejuvenation, the recovery zone getting activated.
Exactly. Here it's sympathetic and parasympathetic in a physiological state. And that's it. Fantastic.
And just to let you know, I have been practicing a little bit because, the first time that I did the scan with Dr. Francisco, then my values were extremely low. So I have access to the system and I've been practicing with the system myself. So this was a result of doing this, at least a few times a week. So now I have enabled myself to be able to, hit into the zones using this technology and being able to maintain that. But still, everyday activity, work, and all the emotions from business and every day will take over. But then now I'm training myself of how to be able to, at will, being able to kind of like put the stress zone down and activate the recovery zone. And once we can do this on a daily basis and repetitively, then we can help so many people achieve high levels of health and optimal longevity. Thank you. Thank you for the work that you're doing, and thank you for introducing this to our network. We really appreciate you.
Thank you for trusting in crazy scientists.
Okay. Thank you guys for watching.